Dr. Judith, I am so thrilled to have you on the show today. And we're going to cover a lot of ground. But the first thing I want to ask you is, and I try to ask all of my guests, sort of their backstory. What inspired your journey into psychiatry, and how did your background shape your approach to mental health?
Well, thanks for having me. I didn't always start off as a psychiatrist. In fact, when I went to medical school, I wanted to be a neurosurgeon. I'd studied um, doing operations on these sheep models for this condition called spina bifida when I was an undergrad at Duke, and I wanted to be a neurosurgeon until medical school, when I actually realized how long surgeons stand for operations, and I thought, "Oh, that's a bit that's a lot." There's gotta be a way to work with the brain in a different way, but initially, I started off as an anesthesiology resident, and I was putting in tubes, all these, lumbar punctures, all these things that a surgical specialty does. I did that for 2 years, and I found myself really isolating and not enjoying the work. And I miss talking with patients. So a friend of mine who is actually a psychiatry resident at Cornell said, that I should consider switching residencies and going into psychiatry. And for medical students, switching and stopping is something that we just don't want to do. Like we kind of have our minds made up, and then we go on this long journey of becoming a doctor, and having to stop is equivalent to failure for us. But I knew that I couldn't do this anymore. I knew that there was something more to medicine than being in a cold OR with a patient under anesthesia. And that's a field that's, I think, very honorable. A lot of my friends are still in anesthesiology fields, but it wasn't fulfilling for me, and I am glad that I took her advice. I applied for this open position at Columbia Psychiatry because a resident there left, to move across the country, and there was one spot, and a bunch of surgeons applied for it, a bunch of other specialties, but I got it, and, I'm so grateful that I came into this world because psychiatry, I thought, was saving me from a life without joy and fulfillment because I hated anesthesiology. But it really did save me personally because I was forced to look in the mirror for the first time and deal with a lot of traumas and past psychological stress that I had been burying for all of my life.
That might be one of the more pragmatic answers I've ever heard. And by the way, the good news is bless you for going into psychiatry and for all the good that you do, which we're going to find out more about in a minute. But I love that just simple. I knew I didn't want to be on my feet, and I knew I wanted to talk to my patients. And so both of those are good reasons for doing that. Thank you for sharing that. So I want to jump right into it because we have limited time and you have such an impressive resume and have done so many positive things. The first question I really want to get into is you wrote a book back in April, I believe, or it came out in April. You wrote it well before that. And it's called High Functioning: Overcome Your Hidden Depression and Reclaim Your Joy. And so there are two really important concepts: the hidden depression and the reclaiming your joy. And we're going to talk in a minute about how we can overcome some of that depression in a minute. But tell us a little bit more about the book and how it's resonated with your audience so far.
Well, when I first wrote a book about depression, I didn't think anyone was going to read it. I honestly thought, why would anybody read a book on depression? Like it's not like finance or fiction. I thought people would just ignore it, but I've been so surprised by how many people resonated with this book. This book is now in over 20 countries and over 17 languages, and we're not even, done with the first year. So I think I'm so grateful that people are curious about the science of happiness. And I say that because you can't fully understand depression without understanding joy, right? The opposite. And joy is such a universal concept. Everyone in the world understands it because it's built into our DNA. Yet many of us forget how to access joy. And when I reframed it this way, I think people didn't realize that they were lacking joy in their lives. In their mind, someone who is depressed doesn't get up, stays in bed, doesn't show up, is not someone who's functioning. But I think through this work, people are seeing that there are many different faces of depression. People can look perfectly fine on the outside, but wear this mask of pathological productivity. and they're hiding their inner struggles. They're hiding something called anhedonia, which is a complex scientific term that essentially means you're lacking joy, you're lacking interest, you're lacking pleasure in things that you once enjoyed. And I think talking about anhedonia, defining it, giving it a name has helped a lot of people because they just thought that was life. Oh, that's just life. Well, no, life is supposed to be joyful. We're built with the DNA for joy, but we just forget how to access it.
Thank you for mentioning the masking piece. I know I have 3 children that have all talked to us about the masking. It's like, "Oh, you seem fine." It's like, "No, you're not." And so that's good to call that out. And I'm actually not shocked, that it has resonated as well as it has, and it sounds like you've been on things like Good Morning America, CNN, Today Show with Oprah, and then you did a really cool interview, which I listened to the entire thing, and it's important because she wrote the foreword to your book. But you appeared on Mel Robbins' her podcast several months ago, and you shared your experience about happiness and mental health. And just for timing's sake, I want to get to the really important piece, which is you had this. Speaking of being prescriptive and speaking of sort of giving people the tools, these 5 V's or these pathways to happiness. And I could tell as Mel Robbins was wrapping her head around it, I was wrapping my head around it as well. And I love just how patient and descriptive you were about that whole thing. So can you share what those 5 V's are with our listeners?
Yeah, when I first went on Mel's show in 2000, last year, 2024, the study hadn't wrapped up, so I didn't have the findings. But I introduced this concept of anhedonia to her and her audience. And at that time, I had this anhedonia rating scale available on my website. And after that episode, my website crashed because over 10,000 people filled it out. And I was just like
That's a
overwhelmed.
good problem
Like,
to have, right?
yeah, I was not anticipating that. Again, when you hear of these terms, you don't think, wow, that's exciting. But the opposite happened. People were excited because they finally had a name for their experience. So then when Mel learned that the study was published, I came back on her show about a year later to talk about um, what I was seeing in the research with high functioning depression and my early findings. And what I described to her was in the study that I conducted at my lab, the first ever study in the world on high functioning depression. We found a correlation between people who are functioning with their symptoms of depression by not breaking down, right? The clinical depression, which means that you have to break down based on those symptoms, but they were actually over functioning. They weren't breaking down, they were trying to run or outrun their feelings by overworking, by busying themselves. So these are folks that when you ask them what happens when you sit still, they say, I feel empty. Or when they're not busy, they feel restless, right? They're humans doing, they're not human beings. And so when I talked about what we're seeing in the study about people not being able to sit still, we wanted to offer ways to heal, not just, okay, look, we did the first study. Now what? And so I really, and given what happened the first time that I was on her show, I was like, I can't go on and like not have anything to offer
Right.
people, right?
Nice
We
forcing
have
function, right?
answers,
Yeah.
but we don't have, we have answers with regards to the study, but we want to have some solutions. And that led me to come up with tools called the 5 V's, right? These are based on positive psychology, mindfulness, work that's an accumulation of my training and what I've learned from others. But there are 5 things that everyone can do, no matter your age, to reclaim your joy. And I use the number 5 because I've traveled to over 30 countries studying health and mental health. And there are certain numbers that show up across the globe, but the number 5 shows up often. And I think it's because most of us have 5 fingers. So I wanted people to be able to look at their hand and say, I have the DNA for joy. I just forgot how to access it. And I'm going to tap into one of the 5 V's every day to access a point of joy. And I use the term point of joy because I have a research lab and I have a private practice. And in the
It's
private
called
practice,
and can I interrupt you for
uh
1 second? I think
yes.
it's called the Happiness Lab, yes? Or at least one of your labs is the Happiness Lab?
Yeah, the Science of Your Happiness lab. But the other lab where I do clinical research is Manhattan Behavioral Medicine, and that's like the more experimental type of novel treatments. But I do have 2 labs, and so I have a private practice where I see patients for therapy and medication management. And whenever people come in for the traditional therapy, psychiatry practice, they say, like, oh, Dr. Judith, I just want to be happy. And I'll ask them, well, what does happiness mean to you? They'll say things like, oh, when I finally pay off my debt, or I finally meet that love of my life, or, finally get the big job. It's always some external factor, something on the outside. But joy in the research is what we measure on the inside, these internal experiences that are basically encoded into being a human. So I'll ask things like, when you ate your meal, did you savor it? When you felt lonely and you reached out to a loved one, did you feel connected and seen? When you were exhausted and you took a nap and you woke up, did you feel refreshed? When you were stressed out, were you able to soothe yourself? These are all little points of joy that when we add it up, we determine if you're becoming happier. And that's what we see in the research. But in the real world, people are like, well, when I get that job, I'll be happy. Or when I get that, love of my life, I'll be happy. But the science shows us that once you hold your breath for these external things to happen and you finally get them, you're still not happy. You're still searching. So we really wanted to reframe and show people that joy is within you. These points, they matter. If you can get 1 point a day, 2 points a day, that's better than having no points, right? A reframe of what the idea of happiness is, the science of your happiness.
Right.
And so the 5 V's are based on these theories that, let's say the first V, validation, right? I talked about one of the points of joy is when you're stressed to calm that anxiety. Well, in our research, we often look at stress as being something that pulls away from joy. So if you're not addressing stress, it's harder to access joy. Validation is acknowledging and accepting how you feel and your experience, no matter what, without judgment. And one might ask, well, what does that have to do with stress? What does validation have to do with stress? Human brains don't like uncertainty. We don't
Mhm.
like the unknown. So if we're able to name things and identify things, that in itself is therapeutic. It decreases the anxiety, it decreases the uncertainty. So name how you feel, acknowledge how you feel. Don't just wait for others to validate you. Start doing that process internally. And I liken that to being in a really dark room. You can't see anything. You hear a loud crash. Some of us would start panicking. But if you turn the light on and you see, oh, something fell, I'm safe. Again, you're decreasing the uncertainty. You know what you're dealing with. So validate and turn the light on your emotions. And that is a point of joy many of us leave on the table, especially those of us who are high functioning. We're so used to pushing down our emotions, pushing down our experiences, that if we continue coping that way, we're also going to push down the ability to feel the joy too. So the first V is validation. And I find it to be the hardest V for many of us.
We don't
The
like to be honest with ourselves, right? It's really like you said, you wanna push it down, push it away, blame it on something else, and so to sit down and call it what it is, I think some people consider a weakness. I would say, and you probably would agree with me, that it's actually a strength if you can do that, right? But it takes training and practice, and so, I can totally see why that would be the case.
Yeah, absolutely. If this is your coping mechanism in life, it's hard to change, but it is the most important V. And the second V is venting. So when people come to my lab, I'll do an experiment where they take turns with a big red balloon and they try to push it down into water. And 100% of the time, that balloon will pop up, right? You cannot outmath the physics. But then when we take turns deflating that balloon, we can easily push it into the water, right? So I use this analogy because when we don't express our emotions over time, it'll pop up in our health. It pops up in our home life, in our work life, in a very disruptive, dysregulated way. But if we get into the practice of slowly venting these emotions in an authentic, intentional way, then we're releasing that pressure on our system. We're releasing that stress. And so venting can't be done verbally. Not everyone has a therapist, but if you do, you can vent all you want to a therapist. For those who don't have a therapist, be careful about who you vent to. You want to be mindful not to vent to your kids because they're in a lower position of power. They're not going to say no. They're going to listen, but they're going to worry about you, right? Don't vent to your employees because, again, that power hierarchy is just not fair. Pick one or two people that there's reciprocity. You go to them, they go to you, and make sure that you're asking for emotional consent. And that looks like, is this a good time to talk? I have something I need to get off my chest. Can you help me? You want to be able to make sure that it's done in a way that is not disruptive, that is intentional, that you're looking for an outcome, not just trauma dumping, right? And but if for those who are not verbal, you can pray. If you're faith-based, you can write in a journal. There are many ways to vent authentically, cry, but, get it off your chest, get it out of your system. And so, that one I think tends to follow, validation, because if you don't know how to acknowledge it, then how are you gonna vent and express it? And then the third V is values. Values are things that, bring our life meaning and purpose, but many of us high functioning folks, we tend to chase the things that have price tags versus things that are priceless. And so when you're thinking about values, you wanna think about things that, "Okay, in my last moments of life, what am I gonna want more time doing? Or who do I wanna be with?" Right? These are things that, really give you that sense that life is worth living. And, we're not gonna be on our deathbeds being like, "I want a Porsche." We're gonna say, "I wish I had
Right.
5 minutes with our family." Right? So try to
I think
tap into
you made
those.
a point, I think, on Mel's show too, where you talked about deathbed and like the only kids that are the only people that notice how hard you worked over the course of your life are your kids, right? And it's not a good thing. So I like these analogies, by the way.
Yeah, or your pets. Mel loves that one too because she has dogs. But,
As my dogs start
really.
to bark because someone's at the door.
And then the fourth is vitals. Think about your body and brain. You only get one. So what are ways that you can support your body and brain? And I talk a lot about nutritional psychiatry because I think it's one of those things we overlook in medicine. We're so busy trying to correct problems, we don't prevent them. And, eating foods that lower inflammation, nourish our brain and body, decrease, things like free radicals and so forth. All of those things are really helpful. Getting good movement, even things like investing in a standing desk, taking the stairs instead of an elevator if you can, getting adequate sleep by keeping your phone in another room. These are all things to do to take care of your body. But I also talk about three non-traditional vital signs, not just sleep, not just movement, not just nutrition, which are the traditional ones, but the non-traditional ones. Like, what is your relationship with technology? Because a lot of the new studies are showing that excessive tech exposure, excessive screen time, excessive virtual meetings, that's impacting our mental health. And, another non-traditional vital is our relationship with others. Your doctor doesn't tend to ask you about that, but we're learning that that's a huge predictor of longevity these days, healthy relationships and limiting toxic ones. And then the third non-traditional vital is really important in high functioning folks is our work-life balance. Really practicing leaving work at work as best as we can and having a life outside of work. And then the fifth V is vision. Plan joy in the future so you keep forward and you don't get stuck in the past. And that includes celebrating your wins. Many of us high functioning folks were like, "Oh, well, I got the kid to school on time. I'm supposed to do that." No, you didn't. That was a choice. You didn't have to, but you did. So celebrate those small wins. Plan joy in the future. If you're working in busy teams, don't just say, "Oh, like we finish a project, on to the next." Create a culture of celebrating joy. All of these things are based on positive psychology. They're not crazy expensive. You don't have to be affluent to do them, and they're within reach for most ages. But again, we often leave our points of joy on the table, the basic points, because we're chasing this idea of happiness.
That's an amazing framework, and I like how accessible they are. And you mentioned that accessibility and the fact that sometimes it is a lot of the little things that add up to the big things. It's not the big, I got the car, I got the job, I got the boyfriend or girlfriend. So I really appreciate that. I did want to talk about your podcast, but I know I want to leave time for a couple of other areas. So I'm going to put it in the show notes. You have a podcast called The Vault. You've had some amazing guests like doctors Mary Claire Haver, Aletha Maybank, who I know, Uche Blackstock, who's going to be on the show before too long. I do want to shift to social media, and this is like a sort of double edge, and you're kind of the perfect person to talk about this. You have several 100,000 followers across TikTok and Instagram and growing for good reason. Um, Social media has obviously come to have a huge influence on our lives and how we see each other, particularly for the younger generation. So, knowing that you are a practitioner as well as a psychiatrist and someone that thinks a lot about these things, what strategies can people use to build self esteem in this digital age, given all the warnings we're hearing from the experts?
Yeah, well, I kind of fell into social media. I started off teaching traditional media to doctors. I developed a course at NYU over 10 years ago, really teaching doctors how to give a press interview, how to, if the press calls them to do a podcast, any all of these things to prepare them for it. But I fell into socials because around 2020, 2021, when the course went from being in person to being online because of the pandemic, the doctors were saying all of our patients are getting their information from socials. So I had to learn how to use these platforms. I had to learn how to use TikTok, Instagram, all these things in order to teach these doctors how to use it. And I remember it was the most bizarre thing. My first video like went viral and got me 30,000 followers like in a week. And I just thought, this is weird. This video wasn't even that good.
That's the crazy thing is a lot of times it's not always the good ones. It's the message
No, it
and
was actually terrible. And I was like, what is happening here? So I was like learning this. But the thing, although the artistic style of it was not that great, the content was that you couldn't find it anywhere else. And that's what I learned was that social media is such an extraordinary way to teach an audience about content that they would not necessarily get anywhere else. Or if they got it somewhere else, it's super dry and boring, right? And like I've been in the seat of the clinician who says, "Oh, like this is a great website. Go to this so and so association and read this." And the patient will never read it, right? It's boring, it's dry, it's not relatable. But if I sent them, "Oh, like I saw this reel on this or I saw this TikTok," they'll be like, "Oh yeah, I saw that too." And they get it, right? So I kind of fell into this world of social media to educate my student doctors, but also to educate the public. And then I found myself in this situation where it's like, well, this is a tool that can be used for good or it can be really, really harmful, right? Just like most things, two things can be true. But it led me to develop this system called the reset method for my clients and also for a lot of the companies that I advise. You know, R is realize how social media is impacting you. For some of us, it helps us to stay connected, but for others, it causes a lot of distress, causes us to be less productive, not get good sleep, have self-esteem issues, have anxiety, depression. So realize how it's impacting you. The E in reset is educate yourself about the research. You know, what is the current data in youth? What is the current data in adults? There was a recent study out of University of Texas schools that showed that when adults were limiting their social and smartphone use for at least 2 weeks, it was almost as if you treated them with an antidepressant. So that was really astonishing because what they found was that people were not they were spending more time outdoors, they were connecting with others, they were getting better sleep. So all those points of joy that we measure in the happiness research, they were getting more of those points. Educate yourself about the recent data. The S in reset is come up with a strategy or a plan. Are you going to limit the accounts that you follow and only follow ones that really make you feel positive? Or are you only going to be on socials for certain hours of the day, limited at bedtime? Are you only going to be on it, midday when you're not with your family, so everyone's eating dinner together and not looking at their phones? Have a strategy and a plan. And the second E in reset is expectation. What are you hoping to get out of this? Are you hoping to feel more calm, less depressed, get better sleep, have more connection, be more productive, have clear expectations? The T in reset is thoughtfulness. Reflect on the process. Was it too rigid? Was it too relaxed? Make modifications if you need to. But I've presented reset to just about every major platform that I've worked with to help their creators to have better balance and also with my practice and at youth organizations, at women's organizations that works for the whole family. And I think it's a positive framework that people can use that's, again, relatable and easy to access.
yeah, it is. I just in hearing you say those words, I feel like those are good ways to frame it, and it's really what you make of it, right? And being healthy about it. So, I appreciate you sharing that. I do want to ask one more question that's related to menopause because you've been a champion of menopause and particularly its impact on mental health. And then we'll get into just a few quick, fast hitting questions, and then we'll wrap up. So this is going to be a twofer. Many women report mood swings, anxiety, depression during menopause. A lot of society as well as HCPs sort of brush it under the rug. I think we're getting slightly better about it these days. So I want to talk a little bit about what can professionals do to better support the mental health aspect that comes along with that. And then my wife had a specific one because she's really become a champion herself in menopause. So she's on hormone replacement therapy. She's sort of on the other side, but what can she expect in terms of returning to her premenopausal self from a happiness and sort of a regular life perspective?
Everybody's so different. But I do use the term ties to help people to understand what are the common mental health symptoms between mental health and perimenopause and menopause. And I came into this work because my patients who had previously had postpartum depression, when they were, past their reproductive years, they were starting to have similar symptoms. And I really wanted to understand this because it's not typically taught in medical school, and it's a really underserved, understudied area. And that led me to develop these methods so that people can understand, and not get misdiagnosed as having something else that's completely not hormonally related, and get the right treatment. So the ties between mental health and menopause, T is thoughts. So a lot of times people have word finding difficulties, brain fog, and thinking issues, problems with organization, planning. The I is identity. They'll often say, I don't feel like myself. And it could be because they're having changes in their body, right? They're not able to move and do things like they feel like as if they used to, their joint changes, urinary changes, sexual changes, and so forth. Um, they just have physical changes sometimes as well, hair falling out, skin changes. And then the E is emotional symptoms. So sadness, symptoms of anxiety, mood swings, irritability. And the S is sleep. So often they'll say they're having a hard time falling asleep or staying asleep, or their sleep quality is not that great. TIES are the ties. And if you can recognize these along with the three Ps. So the three Ps are ways that I teach my patients to determine whether or not you're having depression symptoms, like true major depressive disorder, or the emotional symptoms related to perimenopause and menopause. So the first is changes in your period. That's the first P. Major depressive disorder does not have any period changes. So if you're having period changes and mood changes, you got to think about perimenopause or menopause. The second is physical changes. Major depressive disorder does not have physical changes with it. So you have itchy skin, itchy ears, changes in urinary functioning, palpitations, hot flashes. That is not major depressive disorder. And the third P is past history. People who have a past history of postpartum depression or premenstrual dysphoric disorder, PTSD, are more likely to have these mood symptoms that are more vulnerable during this perimenopause. But if you're having your first major depression in midlife and you've never had these symptoms, think maybe it's related to hormones, right? So the three Ps and ties really helps people to, I think, get the right treatment so they get the right um, uh, methodologies. Because the problem is that if you're misdiagnosed and you're going to be put on meds or given treatments that don't work, and you're missing out on an opportunity to possibly start hormones that can actually help some of those physical and mood symptoms versus being treated with things that are unnecessary. And I talked about this on a masterclass that I did last year. It's with other menopause experts and Halle Berry, and it's available. And I find that that's a very comprehensive way for anyone to learn about possible symptoms of.
Okay, well, we will link to that in the show notes. I know we are running out of time. I'm going to do three sort of rapid, fast hit so you can move on because I think you have to go see a patient. Questions, and that is, what's a word that sounds dirty but isn't? This is how we have a little bit of fun at the end of this.
Masochism. Masochism
Masochism.
sounds
I like that.
dirty,
I like it. I like it.
but it is, in fact, it was a word that was removed from the DSM-3, the Diagnostic Statistical Manual, which is basically the Bible of psychiatry, in the 80s because people were worried that, it was giving women a bad rap, and should have been removed because often it would be used to um, give a title to women who were inciting violence towards themselves, like they were instigating people to treat them poorly, and that's a victim blaming word that should be removed. But there were elements of masochistic personality disorder that I think we should be aware of, like people pleasing, bending over backwards to help people that, and we're not getting the same reciprocal help. So yes, we shouldn't blame victims, but we should acknowledge that people pleasing behaviors leads to problems in people's lives.
Well, it's a great one, and I know that it was funny because you and Mel had a little bit of a back and forth because she said she didn't actually know what that definition meant, so you were able to clarify that. Maybe I'll link to the definition in the show notes as well. All right, two more. You've met a lot of amazing people like Mel Robbins and others. Who has impressed you the most?
Um, so a lot of people have been like, you know, impressing me, but I think for me, I don't get nervous around famous people because people are people. right?
You
Like
have a
you're
very
all
zen sort of like feel about you. Like you're always just even keeled.
well, because people are people, like when you've been a therapist for a long time, you realize that we're just all just trying to figure it out. Like we don't get instructions when we're born. We're all trying to figure it out and we're all gonna die, right? But the one person that really took my breath away and I just became, like, stunned by was Oprah, because she has
I
this,
can
like,
see that.
otherworldly kind of vibe, like, she doesn't walk, she floats, you know?
Yeah.
And she was the one person that, like, I literally she was like, "Hello there," and I just couldn't even say anything. I was like, hi."
I can imagine, and when I saw that you had, been on her show, I thought, "Wow, that had to be at least one of the candidates," so I'm happy to hear that. The last one is name a band or an artist you wish you had seen in concert, ideally one that you wouldn't be able to see, because sometimes it's like, I just missed them because when they came around my town, so who would that be?
Well, I grew up on the Jackson 5, so I know all of their songs. My dad was a big Motown person, so my idols are a lot older, but I just found the fact that their melodies, their hard work, the fact that they were successful Black boys at a time when it was very difficult to be a successful
Yep.
Black boy. I just I wish, and I think I should have been born in the '70s. I think I belong in that era, but
You have that vibe about you, and I know you're significantly younger than that, but, one, I mentioned that you're very zen. Two, you wondered why people gravitated toward you from a social media perspective. You can see that level of trust and that level of calm, and I just think they're all very, it's almost like that, was it AAMSR or what's the, term where you listen to those videos that are very calming to
ASMR.
ASMR, thank you. You are like the embodiment of the ASMR in a good way, so anyway, with that, Dr. Judith, I know you need to run. Thank you so much for sharing all of your frameworks. We've got the V's, we've got the ties, we've got the resets, and so thank you for doing all that. And it's a pleasure to really get to know you. And like I said, I'm going to put all these in the show notes so people can go and listen to your podcast, read your book, and find out more about all the good that you put into the world.
Thank you so much for having me and for being curious about the science of happiness.
Of course.